I'm recording.
Are you?
Yes.
Okay. So we're going to go through self-mobilization protocol for the shoulder. A lot of times people experience pain and discomfort through here. I'm going to go ahead and kind of draw this little area between the spine and, if you see, you may feel for it, right? The border of that scapula. And then there's the spine of the scap. And then you can follow it around the inferior angle, and it's working up and out. And then there's the AC joint where that spine comes up and comes through. So most people experience pain in this area of the upper back. A lot of the times that's because the rotator cuff muscles get tight. Pull this over, these muscles expand. So go ahead and work and roll and apply pressure into these areas to get that trigger point to release. But I want you to focus more on, turn to the side for me real quick. See how he's a little rounded forward? That's the rotator cuff and pec minor, pec major being tight, pulling that shoulder forward, expanding this area, creating tension in the rhomboid region, causing discomfort. So go ahead and rotate for me again. Thank you, sir. So what you want to do is work the different fibers, so the infraspinatus, and they kind of work up and across. Those are the upper fibers of the infraspinatus through there, and then the lower fibers, and then you have the teres that come across through here, right? So I want to pin and stretch and work those fibers and move the arm along the direction that I'm working, right? So if these fibers are coming straight across, that's the direction I want to have the arm in. And as I work down along that border, then I will elevate, right through there, move down, a little higher, move down, and then work across that muscle tissue, right? If I want to get the supraspinatus, that's going to be more through here. I'm going to get some of the trap along with this. Those fibers follow the infraspinatus and the supraspinatus as well. So go ahead and continue this protocol. So when I'm applying the pressure, I want just direct pressure on that rotator cuff. A lot of the times it's a little more sensitive along the attachment point of the border of this scap, as well as down into, you can kind of feel that inferior angle where the three different muscles, the teres major, minor, and the lower fibers of the infraspinatus kind of come together and bunch up right here. So as I pin, we're doing the upper fibers. I'm gonna pin, and then you're gonna go straight across your body. So take the arm across the chest, and then back, and then across, straight across. Perfect. And then as I move a little further down, I'm gonna elevate. So now you're here. Take this arm towards your opposite pocket, opposite hip. Perfect. Down, and then one more time. So to demonstrate those two areas again, I'm gonna have face you, so you can kind of see. I'm on the upper fibers again, go straight across your body. A little more, nope, come back. Let's go straight across. Yep. There you go. And go. So the upper fibers, area 1 that I was in, one more time. And then come in back. Now a little higher, second area that I was in, and down to the opposite hip. And one more time. So that's a little pin and stretch technique that I want you to use and apply when you're working on the infraspinatus. To get supraspinatus, I demonstrated that in a more previous post. Go check that out. Cool, thanks.